Okay. Are we live now? Okay. Well, let's assume that we are, and we have a former patient that wants to tell you his story. He is a nice person, has agreed to discuss his pretty sensitive case. And what was that? Okay. So, Daniel, go ahead and just tell us what you feel like sharing. Let's hear your side.
Okay.
All right.
Okay. Well, I think it's probably helpful if I give our listeners a little bit of idea of how I came to your clinic.
Sure.
I have embraced non-Western medicine more than Western medicine for quite a while, and I felt that I had a lump in each of my testicles, and so I went to my doctor, and she diagnosed me with testicular cancer, noting that it was fairly early, but it was an aggressive cancer, and she suggested that the best therapy for me would be Lesmeding, and she referred me to Dr. Carpenter. We were able to call Dr. Carpenter, I believe it was on a Thursday, and she was able to accommodate starting the therapy for me the following Monday. So we jumped on a plane and went to Tulsa on that Monday, which is when I received my first treatment. She went into, I believe, Dr. Carpenter, we did 3 treatments on each side. Is that correct, on each tumor?
Right. Mm-hmm.
And we were actually able to have the first session of the laser therapy on the Monday when we arrived. Now, I had not seen any Western doctors, nor had I been particularly excited about having anything cut on me, or any chemicals, or any radiation, or most of the other types of treatments that seemed invasive and pretty caustic to my system. So that's, again, why I went to Dr. Carpenter. And the treatments were, I could certainly tell when the cancer cells were being killed by the laser, because there's, obviously with heat and nerves, sometimes you have a sensation of, shall we say, heat and pain. However, I thought that was, whenever that happened, I felt, well, good, we're killing cancer cells. And I was in pretty good shape. I had not had any other treatments, and so my immune system was, I would say fairly active and able to function. I believe that it kicked in pretty hard after 2 treatments on one of the tumors and 1 of the treatments on the others, and I started to get a little sick. But even though we had to wait a few more days, and it took more days than we thought to finish the treatments, we were able to do so. And I was awake the whole time. I understood what was happening the whole time. We had a lot of communication, and I had pretty good assurances from Dr. Carpenter when I left that there was no cancer left. I reconfirmed that with my doctor back where I live, and that was about 3 months ago. And I just reconfirmed about 2 weeks ago with my doctor once again with the test that I'm still cancer-free, and I expect it to be. And I expect that there's no cancer in me. I guess I could go into Dr. Carpenter if you want me to. Some of the processes, some of what I went through as a healing process after I left the clinic. Would that be helpful?
Sure.
Okay.
Your case was a unique case. It doesn't happen that fast to other people. This is a unique case that your
sitting
reaction.
here in fascination. I'm just fascinated. I cannot believe this. Testicular, that's unreal.
Yeah, it is. It's very easy. And actually, that type of cancer is a lot more sensitive to being killed with the laser, with the heat, because the area is used to, the body keeps that area pretty cool. Okay, it maintains a certain temperature in the area, and it's always pretty cool. So heat will get rid of it, will be effective like nothing else. It's just amazing. The thing that got me is that he had reaction that quickly. And, that day you have him, remember, I don't know if it was the last day or the day before, you really had a hard time walking, so...
Oh, yeah. Well, I had never had any experience with my immune system kicking in that hard, but it was really clear to me that it was because I had a bunch of necrotic tissue.
Yeah.
And now I had not researched a lot before we came to you. I have a great deal of trust in the physician that referred me to Dr. Carpenter, and so now my wife had observed on the Liz Medding website how sometimes the necrotic tissue would come through the skin and would drain and would slough that way. And of course, I had a tumor in each testicle, and we treated both of those. I mean, Dr. Carpenter's that was a lot of hours you spent working on my tumors there. About 6 hours each, actually. And so,
yeah.
the point that I wanted to get to. Go ahead. I'm sorry.
Oh, nothing. I'm just giving you the male perspective here. I'm jaw dropping right now.
Oh, it was pretty freaky.
I had a hernia surgery years ago, and man, that about tore me up. Well, you know what happens after hernia.
Yeah. Well.
And
I was down.
Wow.
Yeah,
It put me down for the better part of a month. And interestingly, now I had about a 2,000-mile flight back to where I live. And that was rather interesting because, of course, my immune system basically gave me a couple of grapefruits between my legs. And I just basically had to relax and let this stuff go through. It was interesting because... exactly.
Okay.
Well, you know what I'm talking about. He knows what I'm talking about. On one side, I actually did have a fistula that opened, and the necrotic tissue came out, and I pulled it out, and it started out as a very small little fistula, and it grew to about 1.5 inches. But the fact of the matter was, I just kind of kept it clean, kept it from being, infected. Tried to keep it as clean as I could.
Get infected. It can't get infected, though.
No, it didn't get infected.
It can't. Yeah, because the tissue is dead, it's sterilized, it's killed by sterilization, so nothing can get infected there. So. Right. Okay. Yeah.
So I just kept it clean from the outside. The interesting thing is that opening opened fairly rapidly. In about a week's time, it opened to about 1.5 inches in diameter. The necrotic tissue by and large came out, and the whole thing closed up within 2 weeks later. I mean, it was just like this. It was remarkable to me.
Because usually it's not that fast. It's amazing that yours was that quick. It's just amazing. That's why I wanted you to talk about it, because I never seen it before. I treated similar cases, and of course the tissue gets killed normally, but the healing process is really slow. Yours was amazing. See, because every person is different. Every person has a different experience on the healing process, but everybody gets a dead tissue, a dead tumor. How long it takes to different person to heal, well, that depends on the person. But yours was pretty amazing. I thought that was just something. Oh, we got a break coming up.
Yeah.
Don't go away.
Free speech guaranteed. You're listening to the Orion Talk Radio Network.
Okay. We are back, and I think we have taken care of all the malfunctions and all the problems we have had, all mistakes and everything. But Daniel is still here, and he wants to finish up telling you how he's doing now, what's the result. And as we said, his case has been really very fast healing. Not everybody can expect that, and I don't know why his case is different from others. It's hard to tell, but the bottom line is everybody heals. It's just a matter of time. So
I'm just amazed because I did not know that you could handle testicular cancer. That's
yeah. Not that I particularly like it, but
okay. I shouldn't have said handle. Okay. But seriously,
yeah, it's well, we won't even go to that part. I guess what's important. I think we struck a nerve with Dr. Carpenter. I have been absolutely amazed at how I've been able to recover from this. Again, my diagnosis was at the end of July, and my treatment started on the 1st of August. And I started back to work about 5 weeks after the treatments. I'm basically about 80% physically and somewhat arguably by my spouse sometimes. Pretty well mentally recovered. But there was a huge emotional toll too, and I didn't have any idea that I would need to recover so much emotionally and spiritually as I did physically. So that was sort of an epiphany for me in this healing process. But I'm an avid bike rider, and most people would think, man, you'd go back to do that. And yes, I have been back. I got back on the bike 6 weeks after the procedures. It was not Al. Number one, I don't sit on them. But number two, the fact of the matter is the necrotic tissue had been either absorbed by my system or taken out of my system by the fistula. And now my strength is not there, but 100% yet. But my ability to move and function, I'm back to work about 80% of the time. And one of the decisions I made after this experience was that maybe I'm going to keep it at about 80% of what I did before. So it's enabled me to see life differently, obviously, because whenever you get a cancer diagnosis, it is a life-changing event. And it was difficult for me to handle that emotionally and spiritually. It was not very difficult for me to handle it physically, basically because I was able to use the LaserMed treatments as opposed to things that would either cut part of my body off or poison me. And I don't expect to have a lot of regression. I'm comfortable that I'm cancer-free. Although I will continue to check. I think it's important. Anyway, in fact, my son, when I originally diagnosed myself, he says, man, what do you do? Do regular checkups? So I said, well, the idea of being a biker, that sort of helped me find the tumors.
Yeah,
and so I'm very grateful for that. And that's sort of my story.
Yeah. But
wow.
Yours, the tumors are not all gone, but they're reduced in size, and they will eventually all disappear. You want to point that out. They're not all gone because it's a slow process. But they are reducing in size. Yeah.
Very much so. Even in the last couple of weeks, I've gone down. I would suppose if your testicle is, if you call your testicle about the size of a walnut, I'm probably on one side normal, and on the other side about 2 times that. And it's been shrinking ever since it kind of peaked out there about 3 weeks after.
Yeah.
And yeah, I couldn't be happier with the outcome of my.
Well, yeah. Eventually, all this will disappear, and then you're going back to a normal life, like nothing ever happened. That's the thing, because it doesn't come back. Okay, the people say, what if it comes back? It doesn't.
But I would say that I'm essentially there now. I mean, that's where my head's at, and my body's moving that direction. So, well, listen, guys, I'm going to go play with my grandson now.
I thought I heard something.
Yeah, he's here with me. He's ready to go. And we're going to go play some. But I really appreciate the opportunity, and I hope that my story helps others to see what a marvelous, marvelous blessing this treatment could be in people's lives.
Thank you. Thank you very much, and enjoy your life.
All right.
You take care.
Thank you.
Fascinating, sir. I appreciate it.
Thanks.
Thank you.
Bye-bye.
Bye.
Bye.
All right, let's go.
How about that?
See, grandkids don't give you any, they don't give you any breaks, see? You have to pay attention to them. But see, he can do it. He's still there. See, he couldn't have done that if he had gone through standard treatment. He wouldn't be here now, at this stage now. He would not be able to even talk to his grandkids. Let alone have a normal life or feel good about himself. See, that's the thing. It's just that not everybody heals that fast as he has. But of course, he had an immediate reaction which other people don't have. Usually what happened, yeah.
Blown away. I'm just blown away. I'm sorry. It's unreal.
See the tremendous difference? The tremendous difference in somebody's life handling the cancer correctly and not handling correctly. See, it's an unbelievable difference in a person's life. Now, the problem I have with other patients is the healing process is very slow. So people lose faith. They say, well, the lump is still there. My friends say this and that, blah, blah, blah. My oncologist say this and that. They do the wrong testing. They come to the wrong conclusion, whether it's intentional or it's just ignorance. I don't know.